Dad, how do you like this one? Maybe?
Yeah, honey.
Here, come this way. Come this way. Maybe like.
Oh, my leg!
Dad! No! Okay.
On this week's episode of Untold Stories of LU Med, we see Nurse Kendall face a choppy situation.
Hi.
Hi.
Hi, my name is Kendall Lockwood. I'm a Liberty University nursing student. Can I just verify your name and date of birth?
May 12th, 1946.
Just my dad, if you want to write that down.
Okay, it's great to meet you, EB. So what seems to be the problem today?
Well, I have a lot of pain in my right leg. And it's kind of cold down low.
Okay.
And
So much pain he fell. He fell in the storm.
Wow, I'm so
We
sorry.
think there might be something wrong.
I don't have a pulse. What's wrong with me?
You know what? I'm just gonna go talk to the physician really quickly. I'll tell him all your symptoms and I'll be right back, okay?
It's gonna be okay.
Our patient here is suffering from atherosclerosis, which is causing a obstruction in his right knee. Atherosclerosis is defined as the narrowing of muscular arteries, and this can lead to peripheral artery disease, which is what he has. There are several factors for atherosclerosis. Endothelial injury, what that does is basically the permeability of the arterial wall is compromised, and it initiates an inflammatory response. If this inflammatory response lacks a large amount of nitric oxide, that increases the lipid buildup as well as proliferation of smooth muscle cells. And as smooth muscle cells continue to proliferate, more and more are migrating in, they create a fibrous clot. Also, in addition to this, there's calcification that happens, so everything that is being built up is slowly calcifying into just a hard mass, which is what has happened here, and that is why there is a complete obstruction of the artery.
Doctor,
Yes, Nurse Kendall.
here are all his symptoms. So he has no pulse in his lower extremity. It's cold to the touch. He feels pain there. And I looked at his chart and he has DN.
Oh my, this is a serious case. We need to clear up that obstruction ASAP. Let's use some thrombolytic therapy. Let's do it.
All right, EB, we're gonna start you off on some therapy. That's gonna just break up the effusion in your right leg.
That sounds good.
Okay, all right, go. I'll be back in a moment. Oh no, the therapy isn't working. Whatever will I do? I'll find the doctor. Doctor, doctor, doctor.
Yes, what is it?
The therapy isn't working. What do we do?
Let's proceed with a thrombectomy at once. Back to the patient.
Go. A day later. Go.
The therapy's not working. I found necrotic tissue around his knee. Should probably report this to the doctor. Doctor.
Yes.
The therapy, it's not working. I found necrotic tissue right around his knee. I don't know what we should do now.
Oh my goodness. I didn't think it would come to this.
Is there any hope for him?
A last resort. We could resort to an above the knee amputation, also known as the AKA.
Okay, so thrombolytic therapy was used on patient 40. Thrombolytic therapy promotes rapid disintegration of a thrombi or an emboli. It is often used as treatment for blood clots. It can be administered by an injection or through a long, thin tube. There are several drugs that are often used for thrombolytic therapy, one of which is Altiplace. This was used on patient 40. Altiplase is it's called a tissue plasminogen activator. It initiates the conversion of plasminogen to plasmin, which rapidly activates fibrinolysis. After using the thrombolytic therapy on the patient, it ended up being unsuccessful. So a thrombectomy was also performed, and this also was unsuccessful in removing the blood clot. And the foot and leg, the right leg, became necrotic.
Hi guys.
Hi.
So we talked to the doctor, and it looks like there's only one thing we can do now: an above the knee leg amputation.
Oh my god.
I know.
I'm faint.
It's the only thing?
It's the only thing.
I don't want my life to be prolonged like my wife.
No, Dad!
I don't want to suffer like she did.
He doesn't mean that. You'll be okay.
If I go, I go.
No.
I'll just go on with the surgery.
Okay.
I'll just do it.
Okay.
It's the only thing.
You're really
It's the
scared
only thing
me.
that'll save you.
Is it?
It is.
Okay, I'll do it.
Okay. Oh.
Room 40, which Evie is in, has type 1 diabetes mellitus and therefore is at greater risk for postoperative complications. The physician put him on hyperbaric therapy for 5 days before the above-the-knee amputation. The goal of this is to increase oxygen delivery to tissues by increasing the partial pressure of oxygen dissolved in plasma. This is supposed to help with wound healing, especially important for ED because he has diabetes mellitus, which makes wound healing very difficult. It also increases the killing of bacteria by increasing neutrophils in the system, and it impairs the growth of anaerobic bacteria. Lastly, it promotes angiogenesis and fibroblast activity. So these are all good things for EB. For the above-the-knee amputation, room 40 had no other option but to go with an AKA because of the necrotic tissue. As we saw earlier, the thrombolytic therapy wasn't working, and so a thrombectomy was administered, which did not help in time before the tissue became necrotic. The hyperbaric therapy was to help save as much tissue on room 40's leg as possible. 5 days of hyperbaric therapy and an AKA later.
How you doing today, Evie?
I'm okay. Don't know what I'm gonna do with my shoe.
Oh.
We bought 2 pairs, so, you know.
Guess I'll just toss that.
Well, I'm gonna be back in just a couple days to check on you, see how it's going. So, see you guys later.
Bye.
He seems really depressed. I should review the care plan. Here's a picture of our care plan, and I'm just going to read some highlights from it. Our nursing diagnosis was ineffective tissue perfusion related to tissue damage being necrotic caused by the narrowing of arterial walls with complete obstruction due to fibrous clot, as evidenced by necrotic tissue, diagnostic therapeutic procedures, diabetes mellitus, right leg and foot cool and without a pulse as shown on the Doppler, and complete obstruction of blood flow as shown in the arteriogram. Our first nursing outcome was that within 5 days after the AKA, patient 40 will demonstrate an improvement of circulation. This would be as evidenced by patient 40's extremities being warm to the touch and having a strong and symmetrical pulse, no signs of edema, and a proper color with no signs of cyanosis. The first NIC for this would be assessing patient 40's extremities each time before obtaining vital signs by inspection for cyanosis or edema. The reason we do this is because cyanosis is a sign of poor circulation as well as edema. Our next nursing outcome is that within 10 days after admission to the hospital, patient 40 will experience a significant decrease in death anxiety levels. As evidenced by patient 40 expresses how he does not feel alone or upset and exhibits a willingness to move forward with his life. And the nick for this is that we discuss with patient 40 what his music preferences are and then make them available to him. The rationale behind this is that music has an immense effect on behavior. It can help alleviate feelings of loneliness, stress, and can even encourage motivation. So we're just going to try this new thing today to try to relieve some of your turn that frown upside down, positive attitude. So I just want to ask you what kind of music do you like to listen to?
Okay, well, there's
like
that
the
song.
One, the What Does the Fox Say song.
Yeah,
That
What
one.
Does the Fox
Yeah.
Say?
Really?
You like
Yeah.
that one?
Okay,
Yeah.
well let's get some of that music up in
Okay.
here. You're really feeling it. Do you want to try to get up and maybe walk around, get some of your muscles moving?
Yeah,
The circulation going? Here, we'll help you out.
A few days later.
Hello.
Hi.
Hi. EB, how are you feeling today?
I'm feeling much better. I tackle life, and I'm not concerned about my wife's death anymore.
Wow, EB, that is wonderful.
Day of release.
Happy release day. Now there's just a few things I need to go over before you guys go. So EB, you need to be seeing an occupational therapist as well as a physical therapist. You also need to make sure you're taking time to practice moving around your limb and strengthening those muscles there. So you need to keep your amputated appendage straight when you're sitting. That's really important. Additionally, you need to lie down on your stomach for a few minutes at a time, several days a week, to stretch your hip and make sure that it doesn't shift in any way. So that's it. Do you guys have any questions?
Just thank you so much, Nurse
Thank you.
Kendall. You are great for my dad and I.
Yes.
Thank
You're
you.
the best. Right? When I leave, I'm going to take my shoe and we're going fishing.
I'm so happy for you.
Thank you.
Thank you.